Portion of Daytime Tri-Cities is sponsored by ETSU Health. Once again, it is time to have a great conversation with Meet Your Provider with ETSU Health. And today we're talking with Dr. Will Dodd. And Doctor, thank you for meeting with us today.
Oh, well, thank you for having me.
Absolutely. Let's talk about, you're in two different types of medicine with ETSU Health. You're with pediatrics and with internal medicine. How did you come to get to this spot with ETSU Health?
Well, so there's a training program,
Right.
a residency program in combined internal medicine and pediatrics.
Right.
So you're trained in both. You rotate with all the subspecialists in each specialty, and you take both board exams. So I'm certified by the American Board of Pediatrics in the care of pediatric patients,
Right.
and by the American Board of Internal Medicine in the care of adult patients.
So you can handle both of those specialties. But also, I found this fascinating. You also have a master's degree in electrical engineering.
Well, I had a little different career path before I entered medicine, and I just wanted to work more with people. And
Right.
came up here to Quillen and completed medical school. And I went over to East Carolina University,
Okay.
which is down on the coast of North Carolina, for residency, and came back here to work in pediatrics and internal medicine.
You like being here at ETSU Health?
Absolutely. I love the university. I love the
Right.
patients we care for. I feel like we see a lot of folks with different life stories, and I just love the culture up here and the patients. And I also really like the town. I like living in Johnson City and the Tri-Cities area. I'm a big outdoorsman, and I just love the area.
Well, we're going to touch on that a little bit later when we get into the personal side of your life. But staying on the professional side of life, reading your bio, you mentioned in there several times in your bio, it's mentioned that you love working with people. You like that team aspect.
Yeah.
Involving the parents and the small children and everybody that's involved in the care of that patient.
Absolutely.
You really like that aspect of practicing medicine, don't you?
Absolutely. I think that's the challenge with pediatrics is you're working with parents. You got to convince the parents that there's a problem, or convince the parents that something needs to be changed before good can happen to the child. So, and my coworkers are excellent as well. I work with residents and medical students, and really enjoy that aspect of my work.
And you also, another thing I found fascinating in reading your bio was about working with marginalized groups. When you mention marginalized groups, who are you talking about there?
I just feel like sometimes I'll see a patient who's had a problem, and they feel like nobody's listened to them. And a lot of times just the act of listening to a patient, understanding their concerns and acknowledging them can do more good than any medicine.
Absolutely. Being that shoulder to cry on, so to speak, or that ear that can listen, that is a great way to approach medicine. Is that how you feel about it?
Absolutely. I think, there's not always a medicine or a treatment for every condition, but just having patients feel like they're heard and understood brings me joy.
Yeah.
So.
And talk to me about, there's special challenges with both sets of medicine that you practice, especially on the pediatric side. What are some of the things that you find challenging about practicing pediatric medicine?
Well, I think the whole family aspect is very challenging.
Right.
Kids can't really talk to you a lot of times about what's going on. Probably some of my most rewarding patients are adolescents.
Okay.
So you'll be talking with a teenager about their problems, and they'll reveal that they're depressed or having some sort of issue that they haven't felt comfortable talking with anybody about. And you can really help those patients.
Absolutely.
A lot of times the doctor is the person that they feel comfortable talking with. So you can bring the family together and reach a plan.
All right. Well, speaking of family, let's talk about yours. Let's get on the personal side of things. Tell us about your family.
Well, so I've been married to my wife, Julia. She's a psychology professor here at ETSU. We've been married over 10 years now. We have two toddler children, Henry and Laurel, and they're wonderful. I don't get a moment's rest, but they're wonderful.
I can relate to that, having two boys myself. But you also said you love to go into the outdoors. You love taking the kids and getting outdoors.
Yeah, I go for hikes with my kids. We go for walks all the time. We go play in the playgrounds downtown. Both mine and Julia's parents live here in Johnson City, so we get to go out. I go hiking with my dad a lot, and it's just a great place to live and get outside.
This is a great place for being outdoors, isn't it?
Absolutely.
East Tennessee, Southwest Virginia.
Yeah, even just coming out on Fridays to the concerts
Yes.
downtown.
Right.
I really enjoy that. And,
Yes.
we do a lot of things around town too. So.
Well, looking down the into the future now, let's put get our glass ball, our crystal ball out, and look into the future. What do you see your future at ETSU Health being? What do you see practicing into the future with pediatrics and internal medicine?
Well, I love there's a synergistic aspect to it. So when a patient who's an adolescent gets
Right.
older, they can come upstairs to my clinic in internal medicine and have a doctor that they know in a new healthcare system, and I can
Right.
connect them to resources up there that somebody who maybe didn't know them might have
Right.
a little more difficulty getting things going.
And that's the great thing about ETSU Health, isn't it? Is having the resources available to help all of
Absolutely.
your patients.
Yeah, we have a full behavioral team in both
Right.
pediatrics and internal medicine.
Right.
And, half of pediatrics is behavioral. So it really helps. Dr. Tolliver's team is great.
All right. Dr. Will Dodd, thank you so much for taking some time with
Thank
us
you.
today. Folks, that is this week's Meet Your Provider. The preceding portion of Daytime Tri-Cities was sponsored by ETSU Health.